can be asked, tell me about yourself. The moment you enter the room, first thing first, tell me about yourself. The panel of judges or the panelists needs your name, your age, the school you completed, the program you did, and some good things about yourself. So, example is, my name is Mavis Akest. I am 23, 24, 25, 26 years of age. I completed Achimota School where I studied general arts. I am passionate, empathetic, or a calm person. I always admire the way nurses work. But it's not by force to go and say all of this. Just go straight to the point. Some schools will ask you your name, your age, asa. Then you'll go to the next question. So don't go and be saying plenty things. Just go straight to the point. Just say your name, your age, the school you completed, then the program. Hope somebody become one. Now the be account. It's up to you. Hello besties, welcome back to my YouTube channel. If you don't know who I am, hi, I'm Mavis Akest. So thank you so much for rewatching my videos, liking and then sharing. If you're a new subscriber, don't forget to like, comment and share. And if you're an old subscriber, thank you for sticking and staying. So in today's episode, let's talk about some sample interview questions for general nurses. Because general nurses, we are many, and I am personally a general nurse, okay? Can be asked, tell me about yourself. The moment you enter the room, first thing first, tell me about yourself. The panel of judges or the panelists needs your name, your age, the school you completed, the program you did, and some good things about yourself. So, example is, my name is Mavis Akest. I am 23, 24, 25, 26 years of age. I completed Achimota School where I studied general arts. I am passionate, empathetic, or a calm person. I always admire the way nurses work. But it's not by force to go and say all of this. Just go straight to the point. Some schools will ask you your name, your age, asa. Then you'll go to the next question. So don't go and be saying plenty things. Just go straight to the point. Just say your name, your age, the school you completed, then the program. Hope somebody become one. Now the be account. It's up to you. Why do you want to be a nurse? Why do you want to be a nurse is a question usually then the panel of judges or panelists want to know about you, like something, what is driving you to become a nurse. You didn't choose a midwife, you didn't choose public health nurse, you didn't choose community or whatever. You want to be a nurse. So what is driving you to become a nurse? So you can say, I want to be a nurse because I love caring for people. Nursing is a calling, serve humanity with compassion and then skills. So you have to know the reason why you want to be a nurse. I can't spoon feed you though, but I can give you examples on what to say. Okay. Another thing is, why are you here today? So I am here because I want to be trained as a nurse, or I want to be trained as a midwife. I want to be trained as a public health nurse, whatever. So I am here because I want to be trained as a nurse or as a midwife, as a public health nurse, and to contribute to Ghana's healthcare system. Because even though you're going to be interviewed, you're going there to acquire the skills one day, and then you contribute to Ghana health system. That's all. So don't go and say so many things. Who is the mother of nursing? Florence Nightingale. What are your strengths? I am a calm person, and I'm a fast learner, a good communicator. So you're a calm person, you can work under pressure. Yeah, you're a fast learner, and then you are a good communicator. What are your weaknesses? Sometimes I take too much responsibility. Hey, you take too much responsibility, but you are learning to ask for help. So that is your weakness. Another question can be, how will you manage stress? You manage stress by being organized. You have your own things you do to manage your stress, but this is an example, okay? You can also be asked, what are some qualities of a good nurse? A nurse has to be caring, patient, respectful, hardworking, honest, a good communicator. All nurses must be good communicators, okay? Now, what will you do if a member in your facility is not following the protocols, I would respectfully remind the person or report to a senior. And one no, it also by reminding the background and also by reporting them a senior. That is it, if necessary, because the protocols are very important and they are important to take care of the patient. What does confidentiality mean in nursing? Confidentiality simply means keeping patient information private and not sharing it to others. That is the meaning of confidentiality in nursing. How will you manage a rude patient or relative? How you remain calm and respectful, you listen to them, and then you react to their concerns without being rude. I beg you. What is the full meaning of PPE? Personal protective equipment, the importance of the PPE. The PPE protects both the patient and the nurse from infections. What are some departments in nursing? We have the OPD, the NICU, the theater, the emergency, the maternity unit. We have a lot more. Okay. Full meaning of NMC, Nursing and Midwifery Council. Full meaning of MOH, Ministry of Health, GHS, Health Service. Who is the current Minister of Health, Minister of Sanitation, Minister of Finance, Interior? That one is up to you. I suggest you learn that. What are some roles of a nurse? A nurse takes care of a patient. A nurse checks vital signs. A nurse gives medication. A nurse educates the patient as well. A nurse keeps record. A nurse does a lot of things, but these are the sample things I want to give you all. Okay. It can also be as the duties of a nurse. It's the same thing. So it can be roles of a nurse or duties of a nurse. It can be twisted. Okay. You can also be asked, why should we choose you? Yeah, I want you to comment it under this post. Why should we choose you? And then there are more. Please patronize my PDF. 20 CDs for one. And then if you are not a subscriber, 25 CDs for one. If you want two for a subscriber, is 35 CDs for a subscriber. And then if you are not, 45 CDs for a non-subscriber. So if this video helped you, don't forget to like, comment, and then share. And do well to DM me if you are interested in the PDF, because my PDF has a lot of information you might need before your interview day. And don't forget to like, comment, and follow me for more. If you don't know who I am, hi, I'm Mavis August. See you in my next episode. Bye. Mwah.